This interview features Dr. Wahyu Wulaningsih and includes footage of the devastation caused by an earthquake in Indonesia, Wulan at work in the hospital and the different aspects of her job. A scientist conducts experiments in a lab, a man undergoes an MRI and doctors study the images. A radiologist chats to a patient and a doctor checks on a patient undergoing chemotherapy. At the STEAM Hub, a robotic arm projects the computer-generated smiley face of IRL.
I'm IRL, an artificial intelligence created to find out information about STEAM careers. Join me in interviewing professionals to explore their work. Welcome to the STEAM Hub. Please state your name and occupation.
My name is Wulan. I'm a doctor training to specialise in clinical oncology. I treat cancer patients using medication, which we call chemotherapy, and also with radiation beams, which we call radiotherapy.
How did you enter your chosen career?
As a kid, I didn't want to be a doctor. During the time between my graduating high school and choosing to enter medicine, we had an earthquake in my hometown in Indonesia. I volunteered to help some of the areas which was affected by the earthquake. And it was during that time period that it actually occurred to me that doing medicine is not so bad because you can help others.
Do you believe any hobbies, interests, or aspects of your personality helped you to attain your current role?
That's a good question. I got a lot of hobbies, but they all, I think, have a common root. I like creating things, to break things down and then assemble them. That curiosity is what I find helpful in medicine because it's interesting to see how life consists of things. You see how human body moves, you see how a bug develops or grows from tiny cells into a big organ, into human or animals. And I think that's what drew me into medicine. Because what makes things happen, how things work.
How does science, technology, engineering, or maths play a role in your work?
We use a lot of technology in our work in cancer. We use it to detect cancer, to treat cancer, for example, by more advanced methods in surgery. We use X-ray beams to treat cancer, to destroy cancer cells. We also work with a lot of chemistry. For instance, we use chemical agents which are normally dangerous to your body, but we use that to treat cancer.
Thinking about your workplace and routine, please describe a typical work day.
We don't have a typical day, but we do have a typical week. We usually start with reviewing some patients in the ward. We usually like to see them early in the morning. And then sometimes we have meetings with other specialties, like the radiologists, the surgeons, and we usually go through difficult cases to make decisions about treatment together. Later on, we usually start seeing clinic patients. Now, these patients, they're usually having ongoing treatment for their cancer, so they would come repeatedly. And sometimes you get called if some of these patients, they have any urgent concern. So your day is never predictable, but it's never boring.
Final question. Considering the young adult audience assessing this interview, please respond. Why is STEAM important to you?
I think having a mix of skills, including science and arts, is very useful. People usually think that you have to love, biology per se, but I think a little bit of math, a little bit of physics help you to that as well. In a way, you need to be creative. Sometimes things don't work out and you have to think, where did we go wrong? What goes wrong? And then you start breaking things down and you have to think outside the box sometimes to propose something new.
Text on screen. Interview complete. Sutton STEAMs Ahead is a project funded by a Cultural Impact Award as part of the Mayor of London's London Borough of Culture programme and the National Lottery Heritage Fund.